New research tonight suggests race could play an even bigger role in coronavirus deaths than pre-existing health conditions. Let's bring in Dr. Ayla Stanford from the Black Doctors COVID-19 Consortium. Dr. Stanford, thanks for joining us again tonight.
Oh, thank you so much for having me.
It looked at the coronavirus death rates by county through April and May, and they found that counties with an African-American population above 85% had death rates up to 10 times higher than the national average. Doctor, that's a pretty staggering number. But one of the biggest takeaways is this. That gap, it remained the same regardless of the usual suspects, right? Like income, health insurance coverage, diabetes, or obesity. So what do you believe could be playing a part in causing this?
It's a great question. Something we've encountered has less to do with the amount of money you have or the insurance you have, but has everything to do with the color of your skin. And that was part of the reason why we started the Black Doctors COVID-19 Consortium, as my friends who were insured were going to their doctor and asking to get coronavirus tested, and they just kept hitting barriers and walls as to why they could not get tested. And some of it was you weren't, quote, sick enough to get a test, or you traveled, but those weren't areas where the virus was endemic. So people were making decisions about whether you could get tested based on their own bias and their own level of control.
How important is it, doctor, for your work with the Black Doctors COVID-19 Consortium, that model to be expanded across the country?
The value, it's paramount. It's of paramount importance that people stop blaming the patient. It's because you're obese. It's because of your diabetes. It's because your hypertension is uncontrolled. It's because you didn't get screened for breast cancer or colon cancer or prostate cancer. And look at the tangible things that we can do as healthcare professionals to help someone gain access, to be empathetic to their story for why, and then be an advocate for them. Take action to help them get the better care so that the healthcare outcomes can change. And that access and empathy and action is paramount, because there are some things that this study has identified that we can do as healthcare professionals to decrease the incidence of disease and death, not just with coronavirus, but with healthcare outcomes in all the different areas in African Americans.
Sounds like to have that empathy, you need to listen first and foremost to the patient and what's going on with them. Dr. Ayla Stanford from the Black Doctors COVID-19 Consortium, thank you once again for speaking with us tonight.
Thank you.